I started my journey of cancer treatment way back in 1990 when I started my career at Tata Memorial Hospital, Mumbai. So that was the time when I was given the opportunity of starting bone marrow transplant unit at Tata Memorial Hospital, Mumbai. And we had a lady from Srinagar, Kashmir. She was a case of multiple myeloma, and she was very sick that time. And somehow we treated her and we made her mobile. And subsequently, as a life-saving procedure, we did autologous transplantation on multiple myeloma in that particular lady. Later on, we came to know that probably it was the first autologous transplantation of multiple myeloma in India. And I was the part of that team. So I'm very glad even today I share this knowledge and information to my audience that I performed the first autologous transplantation of multiple myeloma in India. So that's what I can share about that particular patient. And that patient, Mrs. Kaul, I remember her name. She survived for 17 years after that. Wow. And her husband is in touch with her husband. He is settled in Jammu. See, those days procedure was little difficult because the facility for stem cell mobilization was not there. So we took the patient to operation theater and took out the bone marrow from her hip bone. And I still remember that her marrow was so diluted and to some extent damaged by radiotherapy that we could not get enough stem cells from her hip bone. Then we took from tibia, that is leg bone, and some of my colleagues took it from the chest bone also. And then we shifted this patient. She was under general anesthesia, and we shifted this patient back to the bone marrow transplant unit. And after that, next day we transplanted this patient with autologous bone marrow. And I still remember that she had a lot of problems post-transplantation because her disease was very advanced. But on 15th day of bone marrow transplantation, she recovered. And during this period, she had infection, she had ulcers in the oral cavity, that is in the mouth, and she had loose motions, all sorts of problems. She could not eat properly. We had to give her intravenous nutrition, but somehow we could manage her, and she came out and then survived for 17 years. I feel that was a great achievement, because when she came to Mumbai from Kashmir. I'm also a Kashmiri, and when she came to us from Kashmir, her children were small. They were studying in 10th, 11th classes, and she had a daughter also. She was worried that how they will manage, but 17 years gave her enough time to settle the children. So I'm glad about this.